Have you been told you need to stop doing what you love, whether it's exercise, running, or a sport? Well, here at Dynamic, we don't like that answer. In this podcast, we'll talk to leaders in the health and wellness space from Southwest Florida to get the solutions you need to get you back to doing what you love. Welcome to the Dynamic Naples Podcast. What's going on? Dr. Chris here. Today I'm going to talk about breathing yet again, breathing and how it influences low back pain. But first I want to announce that this November 18th we have a seminar coming up, the Wim Hof seminar with Yuri Opendik. This is our 5th time doing it. It's an amazing seminar. I always get something new every time we do it. But part of the reason I'm inspired to talk so much about breathing is, that's the first time I really did intentional breath work, and it just blew my mind how powerful it is, and it's free, sitting right there for you. So let's dive into it. So I'm going to tell you 5 different ways, 5 systems that are affected by breathing that can positively influence your back pain. And it seems like such a simple thing, right? Just breathing, and it is a simple thing. But when you think about how many breaths you take a day, altering your breathing can have a huge ROI, a huge impact on you. And when I have a patient that has low back pain, I'm going to always assess how they're breathing. I won't tell them, I'll watch how they're breathing. And I would say 90% of the time, I'll find that they are a chest-dominant breather. And that's not necessarily a wrong thing. It's just, it gives me some insights into how their system is operating. Because when you're chest breathing, it tends to be more of a fight-or-flight system. I'll dive into that a little bit later. But the first way it can help is through gentle movement. So when someone is in pain, it's pretty natural to kind of go into a panic mode and stop moving and try to rest things, which is, by the way, not the best thing to do. It's probably a relic of the past, probably almost an instinctual thing from evolution. Back when we were living in caves and hunting big fauna, it probably made sense if you got injured, you want to stay in the cave and not hunt it that day and slow down the pack. But that's not how our life is these days. So the nervous system goes in kind of this panic mode, and then certain movements can become sensitized. So when you were laying on your back, and if you're just breathing, you are getting a gentle flexion and extension of the spine with every breath you take. And that's a non-threatening movement to the spine. So you can actually desensitize movement of the back through breathing. Okay, so secondly, there is usually going to be some swelling associated with low back pain. So pretty common where someone's back is a little sensitive to extension. When I say extension, it means like leaning back like you're doing limbo. If you have a narrowed space between the joints, or sometimes you just have a little arthritis maybe, extension can kind of rub the joints together, and that could produce a little bit of swelling. And those facet joints are called, have a little capsule around them, so you get swelling that festers in there. And if you're laying still, it allows it to fester some more. So your lymphatic system is responsible for mitigating swelling. And it just so happens that the major collection tubule of the lymphatic system, it sits just underneath the diaphragm, and it's called the cisterna chyli. So if you start focusing on belly breathing or diaphragmatic breathing, every breath you take, it pumps that cisterna chyli and squeezes that tubule, and it moves the swelling out of the system. So I did talk about belly breathing, and that's usually what I'll recommend. So that doesn't mean that the chest doesn't move. It just means that the breath is initiated by the diaphragm. So, what that looks like is you take a deep breath in, your belly should rise first, and then the chest should rise. Then you exhale, the belly descends, and so does the chest. So it's just the opposite, chest breathing. So this has an effect on the nervous system, right? So chest first breathing is, as I mentioned earlier, that's associated with the sympathetic system. So you're in kind of a fight or flight mode if you're chest breathing. And to be honest, most people these days are generally in fight or flight. Even though you might not feel stressed, if you're concentrated, if you have a fixed gaze, if you're looking at driving, all these things are very sympathetic activities. Even on your break, you might go rush off to Starbucks and get stimulated more. So we just kind of live in this chronic sympathetic state. But this is a two-way street. So you can assess how someone is doing and what state of mind they're in by watching their breathing, but you can kind of hack it and go the other way. So you can kind of trip the parasympathetic system by focusing on some belly breathing. But so your muscle tone is really affected by this, right? So when you're in a fight or flight state, you're tone of your muscles will stiffen because your body thinks you're about to be in a fight or something. And conversely, when you're in a parasympathetic state, the muscles are able to relax. And that's, in my opinion, that's how massage works. You're just stimulating the parasympathetic nervous system, and the tone of the muscle decreases. So there's just another win for breathing and low back pain. So speaking of the muscles, there is a muscle that almost always will get irritated in low back pain. That's called the quadratus lumborum, or QL for short. This is a rectangular muscle attaches from your last rib, your 12th rib, the sides of your vertebrae, and the top of the pelvis. It's kind of that flank pain. And so because of its attachments to that last rib, it has a role in creating a stable support for the diaphragm to move off of. So if the diaphragm is not moving because of the chest first breathing, then that QL can stiffen up, and that will make it very irritated. And one last way is pH, so your acids and bases. So the body sits at rest around 7.4. You can swing between 7.35 and 7.45. The lower you are on the acid-base scale, the more acidic you are, and the higher, the more alkalinic. So it's been known for a while that tissue acidosis, or low pH, can cause trigger points and deep muscle pain. And so you can really quickly alter your blood pH through breathing. So in other words, as O2 rises, you become more alkalinic, and as CO2 rises, you become more acidic. So you can leverage this, and you can mess with your blood gases pretty quickly. So all you have to do is exhale longer than you inhale, so you can build up your O2 and become more alkalinic. So most people breathe too quickly. I would recommend aiming for 6 breaths per minute. So each breathing cycle is 10 seconds. And I got that from James Nestor's book called Breathe, which is a fantastic book. So if you inhale for 4 seconds and exhale for 6, then you're covered. So just in a few minutes, you'll become slightly more alkalinic, and it can help with some of those trigger points you might be experiencing. Just know that you might get a little lightheaded. That's totally fine. That's normal. And that's from being in a mild phase of respiratory alkalosis. So there you have it. There's 5 ways breathing can improve your back pain. It's free. It's simple. The worst that's going to happen is nothing. It literally affects your so many systems of the body, pretty much all the systems. It helps with non-threatening movement, helps with swelling in the lymphatic system, it helps with the nervous system and the tone of the muscles and the pH of your body. So that's all I got for you for this week. Make sure to check out our Wim Hof seminar and try breathing out for yourself. If you have any questions, feel free to reach out to me, chris@dynamicnaples.com. Why guess when you can test? Do you get hangry or crash after a carb-heavy meal? These could be indicators that there is a dysfunction in your blood glucose regulation. If left unchecked, it can lead to irreversible changes. If you catch it quick enough, you can make diet and lifestyle changes that will get your levels where they need to be. 88% of Americans are pre-diabetic and don't know it. Diabetes underpins many of the pathologies we deal with in this country, such as obesity, high blood pressure, heart disease, and stroke. For some reason, it is rarely screened with your physician, and if they do test for blood glucose, it's usually with an A1C or a fasting glucose, which can sometimes give you a false negative. NutriSense is a company that supplies continuous glucose monitors. We've paired with NutriSense to get you real-time data to see how your physiology responds to glucose. The NutriSense app lets you track your daily activity to see how food, sleep, exercise, and stress impact your glucose. You can log or import this data into the NutriSense app to see the effect on your blood glucose levels as soon as it happens. Use the code DrChris25 for $25 off your order today. Do you have unexplained pain? Or do you wonder just how healthy you are? When was the last time you had your blood tested? Blood chemistry analysis is a great tool to stay ahead of any health conditions, and now you can have control of your health with Let's Get Checked. Let's Get Checked is an incredible company that sends blood tests to your home. You can choose from over 30 different tests, whether that's thyroid function, testosterone, micronutrient, cholesterol, or C-reactive protein, which is a marker for inflammation. It is sent to you with free shipping, and you get results in 2 to 5 days. No physician referral needed. Use the code DPT25 for 25% off. You can find links in the show notes. Did you know that you can get started with physical therapy without a physician's referral? Physical therapists don't just solve pain, we get down to the root cause and keep it from coming back. We also discuss all things health, such as nutrition and lifestyle changes. If you feel that you could use some help, let's get on a free consult call. Go to www.dynamicnaples.com and sign up for a free call. Also, if you like this podcast, please give us a rating wherever you listen to podcasts. It helps us spread the message. Thanks for listening, and we'll see you next week.